Osteomyelitis. It is an inflammation of the bone and the bone marrow, and it is classified into two types, primary and secondary. The primary is called when the bone is the primary solitary focus of the disease, and the secondary when it is a complication of the any systemic infections. Then types of the osteomyelitis. It is pyogenic osteomyelitis, tuberculous osteomyelitis, and the chronic non-specific osteomyelitis. Next is the pyogenic osteomyelitis. Etiology: it is usually the bacterial infections. About the 50% there is no pathogen is isolated, but the most commonly Staphylococcus species is responsible for this. In the 80 to 90% cases it is Staphylococcus aureus, and other bacteria involved are the E. coli, Pseudomonas, Klebsiella, Neisseria gonorrhoeae, Haemophilus influenza, and the Salmonella. In case of the E. coli, it is mostly infect the IV drug abusers and the patients of the GIT. And for the Haemophilus influenza, it is most commonly affect the neonatal period, and neonatal period also can be affected by the group B Streptococcus, and Salmonella will infect the patients of sickle cell anemia, etc. Then it can be a mixed bacterial infections like the direct spread or through the open surgery or the fracture. So usually it is the bacterial infections. Most commonly Staphylococcus is involved, and other there is E. coli, Pseudomonas, Klebsiella, and mixed bacteria also can be involved by the direct spread or the open surgery or the portal entry of the organism. It may be hematogenous route or direct implantation or the spread from the adjacent sites. In the hematogenous route, the source is the focus of infections anywhere in the body. It may be a skin pustule, or it may be an infected teeth or the gum or intestinal mucosa, etc. Minor injury to the mucosa, like the vigorous chewing of the hard food or the brushing the teeth, etc., or the minor infection in the skin which will release the organism into the blood and causes the temporary bacteremia and then going to the bone. In the children of the age 5 to 15 years of the age, or the drug addicted person which will infuse the needle, then it will attack the long bone. In case of the direct implantation, it entered through the penetrating wound or the open fracture or the surgery, etc. Then Staphylococcus, Streptococcus, and this anaerobic organism will enter the bone directly. Or another path is the spread from the adjacent sites. Like the infections in the feet, it is going to the bone, as we seen in the diabetic patients. So all of them now enter, and then in the location of infections. In the neonate, it will infect the metaphysis or the epiphysis or both. In the children, it is most commonly entered through the hematogenous pathway, and they will attack the metaphysis of the long bone like the knee, ankle, and the hip joints. And in the adult, it attack the epiphysis and the subchondral region. Next is the pathogenesis of pyogenic osteomyelitis. First step is there is transient bacteremia will occur. When there is mild injury or trauma, then bacteria will enter and causes the transient bacteremia. Then next is infections reaches the metaphysis of the long bone. Then inflammatory reactions will occur, necrosis of the bone will occur, formation of the sequestrum and draining sinus formation will occur. And last is the involucrum formation. When there is any mild trauma or the injury, then organism will enter into the blood and it will causes the transient bacteremia. As metaphysis is having the capillary loop, so blood flow is slow there. So bacteria get time for the penetrating the blood vessels wall, and they form an infective foci within the marrow. Next is inflammatory reactions will occur. In the bone, bacteria will grow and it will stimulate the acute inflammatory reactions with the formation of the exudate, which will increases the pressure over the adjacent blood vessels and decreases the blood supply to the bone, and it will causes the necrosis of the bone. And necrotic area will coalesce to form the further bacterial proliferations. Then the formation of the sequestrum. Bacterial infections and the pus will spread in the cortex and then collect beneath the periosteum and causes and lift the periosteum, so decrease the blood supply and causes the suppuration or ischemia. Then there is segmental necrosis of the bone will occur, and this fragment of the dead necrotic piece of bone which embedded in the pus is now called the sequestrum. Next step is draining sinus formation. Pus will penetrate the periosteum and going to the soft tissue and form the soft tissue abscess, and it will now penetrate the skin and in draining sinus will form, and the hole formed in the bone is called the cloaca, and the sinus tract now epithelialized and remain open and drain some pus, and it will contain the pus, necrotic bone and the bacteria. Then the involucrum formation. After the first week, there is chronic inflammatory cells increases, and there is cytokine release also increases, which will stimulate the osteoclastic bone resorptions and depositions of the reactive bone in the periphery, and the sheath around which will form the sheath around the necrotic sequestrum, and it will call the involucrum. So overall bacteria will enter into the blood, causes transient bacteremia. Then as in the metaphysis, the blood supply is slow, so bacteria get time for penetrating the blood vessels and form a infective foci within the marrow. And then in the bone they will grow and causes the acute inflammations with the exudate formation, which will give pressures over the blood vessels, and blood supply will decreases in the bone, and so necrosis of the bone will occur as the necrotic area cools, and then further proliferations of the bacteria will occur, and then the bacterial infections and pus will spread, and it will now penetrate the cortex, and they will deposit beneath the periosteum and causes the lifting of the periosteum, and also there is decreases blood supply, and a suppuration or ischemia will form, and a segmental necrosis of bone will form, and then is fragment of the necrotic bone which will embedded in the pus is now called the sequestrum. Then the pus will penetrate the periosteum and going to the soft tissue where it form the soft tissue abscess, and as the soft tissue abscess will penetrate the skin and draining sinus will form, the whole form in the bone is called the cloaca, and now it will sinus will epithelialized, and it will contain some uh, pus in necrotic bone and these bacteria. Then involucrum formation. After the first week of the infections, then there is chronic inflammatory reactions will occur, and also there is cytokine release, and it will now stimulate the osteoclastic bone resorptions and also depositions of the reactive bone in the periphery, and it will form a reactive bone around the necrotic sequestrum, and this reactive bone is called the involucrum. Next, the morphology. Depending on the stages and the location of the infection, it is divided into acute osteomyelitis, subacute osteomyelitis, and the chronic osteomyelitis. Grossly, we can see the sequestrum, which is a fragment of the bone with a ragged brownish black colored margin. And microscopically, initially there is an acute inflammation, so we can see the neutrophil, and in the next stage there is chronic inflammation, so see the lymphocytes and the plasma cell. The sequestrum do not have the osteocytes; it's have the empty lacunae. Morphologic variants of osteomyelitis. Two types of the variants, Brodys abscess and the sclerosing osteomyelitis of the Guerin. The Brodys abscess, it is a distinct form of the subacute pyogenic osteomyelitis, where there is inadequate treatment of the infections by the less virulent organism. There will formations of the small solitary intraosseous abscess. We can see it in the metaphysis, and which is surrounded by the reactive bone. And in the sclerosing osteomyelitis, there is extensive new bone formation which will obscure the underlying structures of the bone, and it is most commonly seen in the jaw. Clinical course of the pyogenic osteomyelitis. It is present with the malaise, fever, chill, and the leukocytosis. There is throbbing pain on the affected region. Diagnosis is that radiography, where a lytic focus of the bone destruction surrounded by the zone of sclerosis can be seen. In the blood culture may be positive. We can detect the organism responsible for this, and in the biopsy and the bone culture. Complications. Complications of osteomyelitis is that septicemia, acute suppurative arthritis, pathogenic fracture, squamous cell carcinoma, amyloidosis, and the chronic osteomyelitis. As the infections in the bone will occur, it can disseminate through the bloodstream and causes the septicemia. Acute suppurative arthritis, that is, from the articular surface, the infections can go into the joint and destruct the articular cartilage and causes permanent disability. As the epithelial sinus tract can causes the squamous cell carcinoma. Chronic osteomyelitis occurs when there is delay in the diagnosis, there is extensive bone necrosis, when there is inadequate therapy.